Hello again. My name is Melinda Frost, and I'm with the World Health Organization. I'm leading the risk communication and community engagement portion of the response for COVID-19. I'd like to welcome you to today's EPI-WIN webinar. EPI-WIN stands for the WHO Information Network for Epidemics. And today's webinar is particularly interesting and poignant. We're going to talk about how to listen to community feedback and how to incorporate that feedback and better close the loop to help inform action and response. We're doing this in conjunction with our partners at IFRC, and I'll turn it over to my colleague Umbretta Baggio in just a moment to introduce our panelists for today. But this is going to be a really interesting session because we're going to talk a lot about how we can better get community feedback. We're going to address the challenges and then really try to come up with some ways forward on how to better address this important sort of gap in our response right now for COVID. So the way we're going to start off this webinar is to get some ideas from you on how to better shape our conversation for today. So we're going to start off with a poll that helps kind of direct us in terms of some key challenges that we're seeing in terms of getting community feedback. So I'm going to ask my colleague to go ahead and put up the poll. And when you see it on your screen, there you go. You're going to have a minute or two to be able to respond to this question. It's a multiple choice question. And we're going to ask you to please choose the top 3 channels challenges, that you're identifying in terms of community insights that will drive the COVID response. The first response, and again, you just choose 3 that are most prevalent in your setting. The first one is ensuring the voices of women and vulnerable groups that are included in the response. The second option is feedback data is often relegated to the too hard basket when it comes to taking action. So meaning that we just can't address that, that's too difficult. The third option is qualitative insights may be perceived as less credible by experts who have had more trust in quantitative research methods. And then the next option is community feedback. Work is siloed and only the problem of RCC, risk communication and community engagement experts, and often used only in update of messaging. The next option is lack of monitoring on how the community feedback is being addressed and by whom. And then the final option, I believe that's the final option here, is local media is not engaged as a genuine partner beyond simple PSAs and one-directional information. So if you could just take a minute there, read through these options, choose the 3 that seem of most challenge from your experience, and that'll help shape our conversation for today. Thank you. Give another minute or 2. Let's see. Please take this opportunity to vote. It's rare that you get some choices in conversation for these webinars, so please take the opportunity to do this. Okay, we'll give you a few more seconds to respond. Okay, I'll give you a countdown. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Okay, and we'll close it out there. Thank you for sharing your experiences. So it looks like our top challenge is lack of monitoring on how the community feedback is being addressed and by whom. And that was by a long shot. The next most prevalent challenge was ensuring that the voices of women and vulnerable groups are included and community engagement. And it looks like there's a bit of a tie in the next three topics. So feedback data is often relegated to the too hard basket when it comes to taking action. Qualitative insights may be perceived as less credible by experts versus quantitative research methods. And then next in line, pretty closely behind that, is community feedback work is siloed is only the problem of RCC experts. And that can be an issue because maybe in some settings, RCC is not actually included as part of an equal player in terms of incident management responses and so on. Great, so that gives us a way forward in terms of our conversation for today. I'm going to turn it over to my colleague, Umbretta Baggio from the International Federation of the Red Cross to introduce our speakers for today. Umbretta?
Thanks, Mindy. Thanks so much. And good morning, good afternoon, and good evening, everybody. Thanks for being with us. Catherine, if you can go to the next slide. Thanks for voting. We want this webinar to be as engaging and interactive, and we really want to listen to your ideas, your challenges, and your recommendations. So the idea of this webinar is, and thanks to WHO for creating this community of practice, is really to discuss some of the key challenges, but also come up with some key recommendations that we want to put on the table of stakeholders that are dealing with the COVID response. So from here, with the 4 challenges that you've identified, we will go to the presentations, which will be very short, and then open up to your recommendations, your challenges, how you've dealt with those challenges, and have a dialogue and an interaction. What we've seen over and over in our field experience, and I'm sure you've seen the same, is that if we really want to have an effective and efficient response, we need to understand and unpack what people think, perceive, and understand of this pandemic. These community insights really help responders, and not only community engagement experts, they help all sectors and responders to address the underlying anxieties, to address the fears, and this contribute to enable a community-led, a true community-led response. It contributes to enhance the trust among responders and the communities we're trying to support and work with, and this has an effect in ensuring that the whole response and the measures are being really adopted by the communities and led and supported by the communities. So we'll have 3 panelists today. The first one will be Eva, who is a senior advisor for community engagement and accountability with the IFRC in Africa. She's leading on rolling out a very interesting feedback mechanism, which is rolled out at the regional level in close partnership with many partners on the ground. The IFRC is collecting on a weekly basis from over 30 countries, community insights and community feedback from Eastern and Southern Africa and Western Central Africa. So she'll share some of the insights, but also some of the successes and challenges in using this feedback across partners. We'll then have Irene Scott from Internews. She'll share, we go from Africa to Asia, and she'll share with us a very interesting experience that started in March with the partnership between Internews, BBC Media Action, Translation Without Borders, Standby Task Force, and Bisha News. And it's about collecting and analyzing rumors misinformation in multiple languages, in multiple Asian languages. And this comes from internews experience across different countries. We will then close the presentation with Meg Sattler, Director of Ground Truth Solutions. And this is another experience. So Ground Truth Solutions has been tracking perceptions of aid recipients in multiple countries to share with us, again, the key findings, lessons learned, and ways in which this approach can be used to really drive and inform the response. So you've seen we'll have different regions and different type of methodologies presented. So I'll give the floor to Eva for starting the presentation. At the end of the three presentations, we will open up to the questions and answers. Please use the chat. I'm sure you're used by now to interacting with us on the chat. Please do use the chat for asking your questions, but very importantly, for giving your recommendations from the work you've been doing on the ground. Over to Eva.
I'm sorry, Eva, just 1 second. Sorry, hi, this is Mindy Frost again. Just to reiterate, actually, when you ask questions, can you please put it into the Q&A function of your Zoom link, not the chat, okay? That allows us to capture them and ensure that your questions will get responded to. So thank you. Sorry to interrupt.
No worries at all, Mindy, and thanks very much for the introduction, Ambretta. And hello, everyone. It's a pleasure to be here with you today and to talk a bit about how we are listening to community feedback in the Africa region. So as mentioned, I'm the Community Engagement and Accountability Delegate for IFRC in the Africa region. And what I want to share with you today are some lessons we have learned on when establishing interagency community feedback working groups in Africa. Next slide, please. And apologies about the formats. This got a bit mixed up when the slides were merged. So let me first start talking a bit about our IFRC community feedback mechanism before I start talking about the interagency working groups. So in Africa, we are supporting 49 extremely diverse countries. So it was tricky in the beginning setting up a feedback mechanism. It is still tricky setting up a feedback mechanism that works for these diverse countries. And what we've been doing is to identify appropriate and realistic ways to collect and document community feedback. So to look at what is already happening, where and when are our community volunteers already interacting with communities and already hearing feedback such as concerns, questions, suggestions, and rumors, and how can we make sure that this information, these insights are documented and analyzed. So what we did was to provide guidance and develop templates to share with our colleagues on the country level and to provide regular support to make sure that insights can be shared on a regular basis. And we then analyze the feedback we are receiving from these different countries on the regional level. And we produce regional information products such as regular community feedback reports, but then also fact sheets answering the most frequent questions and the biggest concerns communities have, which help then our volunteers to answer questions and to cover these topics during their social mobilization activities, but also videos featuring our head of health and care and our health coordinator, both in English and French, to address the most common topics. And this all is done with the aim of enhancing the capacity of our colleagues on the country level to replicate the same process, to produce their own reports and produce their own question and answers documents, engage with the data, and take decisions based on community insights. Next slide, please. In here, I just want to show you a report where the latest community feedback trends, not the report, but the graph that I actually produced this morning for our next community feedback reports, just to give you an idea on how we've been reporting on the data. So here we see the topics that we heard across countries in Africa. So this graph shows us, this is based on data received from 10 countries in the region. And the data was shared between the 15th and the 26th of July. And here we see that the topics that are most common across countries are the beliefs about who is or is not affected by the disease, as well as beliefs and concerns about protective behavior. So the belief about who is or is not affected by the disease is often that people think that Africans cannot die of COVID, that it's just a disease of rich and influential people or those that are traveling. And this is also linked to the belief that the disease does not exist in the specific area, that it has already ended. So all this information then helps us target to make sure that we are providing the right information, to make sure that we can provide targeted recommendations on how to address these topics, make sure, like in our feedback reports, we then also provide recommendations on which materials to use, what steps to take to address these issues. So to share videos of people that have recovered, to work with health authorities, to make sure that we are discussing with our colleagues on what to do to help communities adopt healthier behaviors and protect themselves. Next slide, please. But now let me talk about our interagency feedback working groups. So these are working groups that were set up to with the aim of sharing and discussing main community feedback trends and to encourage action across pillars and agencies. So we have our IFRC feedback mechanism, but other partners have other approaches and other valuable community insights. So these feedback working groups were set up to get together to look at what the main trends are that we are seeing and to discuss how we can act on that and how we can work with the other pillars of the response to address these topics. They were set up as sub-working groups to the RCCE, to the broader RCCE working groups for East and Southern Africa, as well as West and Central Africa. And it's based on a model that was piloted in the DRC Ebola operation, so the EVD operation in Eastern Congo. And here I want to show you what the process looks like. So we start with partners sharing the main trends using a very simple Google form. And we then get together and think about what recommendations we can make to address these topics. What needs to happen? Do we need to recommend something to our RCCE partners, or does something need to be discussed with the case management working group, for example? We then produce simple presentations and reports which outline the main trends, but also include these concrete recommendations. And this is then followed with discussions with the technical working groups. So it's not enough to only share the report, but then also to visit the coordination meetings of these technical working groups and to share our recommendations and to discuss the feasibility of the recommendations and what can be done about them, how we can support the implementation of these recommendations. And then these recommendations are then, sorry, there was still one last point. The recommendations are then documented in an online tracking table. So everybody has access to this online tracking table, and you can then see which actions have happened by whom to address these recommendations. Now we can move to the next slide. So just to give you a few examples of what has happened to address community feedback. So for example, we are working with the case management technical working groups to improve communication and policy shifts. For example, in Kenya, quarantine changed to be free of charge, which was not known by the community. So this was a feedback that was addressed. Then the production of videos to address specific topics. as well as the development of practical guidance, practical resources such as guidance notes, so an interagency guidance note on PSS tips, on community-led solutions, or fact sheets addressing specific topics were produced. Then also a community feedback brief, so a deep dive on communities' challenges to adhere to public health measures, to be clear on why certain measures can't be followed and what the specific challenges are. Then social science briefs have been produced to respond to feedback such as cross-border briefs, the sharp cross-border brief that is soon to be published. Then also we have also started to organize media webinars targeting local journalists, but also share resources. Some partners might have resources that can be used for the specific topic, and others don't know about that. So that's also an important part of discussing the community feedback and discussing how to address that, as well as collaboration with the MHPSS working group. Next slide, please. And just very briefly, because we don't have a lot of time, but I just want to mention some lessons we have learned from the process as part of the EVD response and of COVID-19. So what we saw that it was easy to set up these groups because they had already, we already have such a group in Eastern Congo. And also it is refreshing having these groups in discussing about the main trends and what we can do about it, rather than discussing and thinking about harmonizing approaches, because everybody has different ways of interacting with communities, of engaging with communities and documenting feedback. So it was great to see that one can get much more done when just sitting down, looking at the main trends and discussing concrete action. What can also be seen that it is absolutely essential to have the buy-in from the chairs of the technical working groups, especially of the risk communication and community engagement working groups that are of really good support, and also make sure that the RCCE working groups are following up on these actions. And then also what I already mentioned, that it's important to not say like we, the RCCE working group or sub-working, like the feedback people, we think you should be doing that, but to communicate that clearly as our suggestions. This is what we've heard, this is what we would suggest to do, how can we help you with that? Does that make sense to you? Or how could we reformulate that? Then sharing the reports is not enough, so there really needs to be a discussion during coordination meetings or bilateral discussions, as well as a link to the social science groups is really important. So that's what we saw in the EVD response, that it was that it's really important to reference social science research findings in our reports and vice versa. Also, it's important to position the group if you want to set up a community feedback working group where you can expect most support. So it was difficult in the EVD outbreak to have the group situated under the Communication and Community Engagement Commission, because this commission was not did not have a lot of influence within the response, but on the regional level it works well for us because it's a strong group. And last thing I wanted to mention is that the regional group can rather be used for influencing the strategies in general, but the concrete actions to concrete operational changes rather happen on the country level, and this is what we really need to focus on as on the next step, but is outside of the scope of the regional group. This is all from my side, so over to you for I don't think there are questions now, so I think we will have the three presentations first and then questions and answers later.
Thanks, Eva. Thanks so much for the insights. So we'll leave the questions to the end. I know that you are adding your questions to the Q&A function, so please continue to do so. We want to hear also your recommendations. Please also reflect on on those based on the key challenges that you've voted at the very beginning. I'll go now to Irene Scott. Over to you, Irene, for the presentation. Thanks.
Great. Hi. Thanks for giving me the time to have a talk today. So my name is Irene Scott. I'm the project director for Rooted in Trust, which is a new project that Internews is launching at the moment. Next slide, please. So rumor tracking is something that Internews has done in lots of different contexts and has been doing for about the last 7 years in many different humanitarian contexts. You can see an example of a few of them just there. Usually we're collecting data through a number of different ways. It might be face-to-face communication, it might be utilizing community radio, or building networks of health workers that use shortcode SMS, for example. And you can see there that that is the Managing Misinformation in a Humanitarian Context manual, that how-to guide that actually takes people through the full methodology and a number of case studies of how to do rumor tracking in a humanitarian crisis is available on the Internews website. So we're very transparent with our methodology. Go steal it, use it, and let us know if we can make it better and contribute to best practice. Next slide. So since COVID, we've been running a few different projects that are aimed at countering mis and disinformation in this crisis. So there's a project that we started in March that ran until the end of June, and that was the Healthy Info Ecosystems for Healthy People project that was funded by H2H and DFID. And that involved social listening across 8 languages in Asia. And so by that, we were collecting rumor data. We were looking at what people were saying about COVID-19, the rumors that were spreading that might be in the form of a question or a concern or a belief, but really trying to understand what were the localized concerns in each of those different locations about COVID-19, and then working to address that. So we address that through supporting local media and community influencers, and by giving them the tools they needed to be able to respond to these questions and concerns. So it's a case of helping local media understand what the questions and concerns are, for starters, and then making sure they have the resources, they have the tools, and for example, training and things like how to understand if a clinical trial is worth reporting on or not, you know, the things to look for. So we were really trying to build a peer-to-peer community of media and humanitarian coming together there to be able to address those problems. But it also really connected with the humanitarian and health communicators as well through the RCCE groups. And that's really important because it means that not only are we supporting local media to respond to the rumors, but we're making sure they have access to the most current verified information from verified sources, and that is contextualized for their location as well. So that project ended at the end of June, but we're now launching what I guess would be called the big sister or the big brother of that project. It's called Rooted in Trust, and we're operating in 7 countries around the world. So it's a contextual response to infodemic challenges. We'll again be looking at collecting rumors and misinformation from the community and using that as a way to inform humanitarian and health actors and to help them base their programming on the community's actual needs and concerns and wants, but also again working with local media to make sure that they're fully equipped to be able to respond to these concerns and to continue this discussion with the community to understand what their needs are and continue to address them. Next slide. So what can rumors tell us? You know, we often get the question of why are we looking at rumors and why are they important? And I think rumors, just like every other type of community feedback, are really important because they give us an insight into what the community is thinking. They can point towards information gaps. They can point towards, perhaps in this crisis, public health information that has been misunderstood or misinterpreted. They can, of course, point to concerns, anxieties in the community, and quite often suggest, you know, much larger issues that the community is actually facing. You know, we try to very much not take rumors on a face value and purely match them with a fact. I think all of us know this far into the crisis that simply giving someone a fact does not necessarily defeat the rumor. So we try and use them as an indication of how the community is feeling at that time, and to better understand how we might be able to work with humanitarian and health actors to respond to those concerns. And they're also an early warning mechanism. So we have a risk matrix that we use when we're looking at rumor data to determine You know, is this, for example, a rumor that might cause harm to that person because of the behavior it's promoting? It might cause harm to the wider community or health system. Perhaps it's encouraging division, prejudice or stigma amongst communities. And perhaps it's, you know, encouraging people to avoid testing or treatment, which obviously has a much broader societal impact. So we try and use it as an early warning mechanism as well for some issues that might develop in the community. I say in defense of small data because the way that we collect our rumors and our methodology is that we're certainly not trying to scrape thousands of conversations from social media every day and analyze that as a point of action. I think there's definitely an argument for having smaller amounts of high quality data that you're able to analyze very quickly and therefore work with humanitarian and health partners to respond to quickly. There's definitely a law of diminishing returns sometimes that you can have much more data, but it doesn't necessarily give you higher quality information to then be able to act on and work with your partners on. So what we're aiming for is really a qualitative approach, small amounts of high quality data, and using that as really targeted information to analyze and respond quickly. The benefits of real humans. The reason I have that in there is that what's really important in our model when we're tracking rumors and misinformation is that we try and work with people who are from the community that we're trying to understand. And that's really important for a number of reasons. I mean, one really key reason is that obviously they speak the local language. It also means that we're able to have our data to stay in that original language and not be translated into 2 or 3 other languages, slowly losing meaning and being misinterpreted along the way. It means that we can have people that understand that culture really interpreting that information as well. So that means that for someone like me, they can help me to understand, is this post that we're looking at satire, or is this a serious post? Is it using codified messaging? Are there particular people that it's pointing towards in this post that might not be obvious to people from outside that community? So it gives us really that contextual and cultural guidance to understand that information as well, which is really key. And putting real needs at the center. I mean, that's what we're all about with this entire webinar. What's really for us in our approach is that collective health and humanitarian partners. So not running a rumor tracking system off on our own and we keep the data to ourselves and we deal with it just in our programming. It's really about making sure we collaborate as much as possible to pool data that's available and to be able to work with many different responders to respond to the questions and concerns that are being raised. You know, building on the strengths of multiple partners to communicate in many ways and making sure that we're creating demand-driven content. So, and what I mean by that is content and information for the community that is based on the actual needs and concerns identified in the data, rather than a top-down messaging campaign that might be based on some very valuable information for the community, but it might not be the actual information that the community needs at that time. So we're looking at highly localized information. So it might be, for example, instead of a message like wear a face mask, it would be, well, where can I buy a face mask? Are the face masks in the local market good quality? Are they the right price? Can I wear a bandana instead of a face mask? You know, it might be very localized questions where a simple message like get tested, wear a face mask would not really give the person enough information to be able to take charge of the situation and take steps to protect themselves and their family. Next slide. Okay, so social media is obviously just one piece of the puzzle. I'm talking a lot about social media today because that's currently a lot of the ways that many people are doing rumor tracking, because we do have issues with physical distancing and trying to keep our teams safe. But it is really important to point out, of course, obviously with social media, some people miss out. Lots of people miss out in many contexts, and it's not appropriate for every context. It's really important to understand the ecosystem where you're capturing information, and understand whose information you're capturing and whose you're not, and to be able to supplement that. The iceberg challenge with social media, it's a massive challenge that because so much of the rumors and misinformation that is shared about COVID-19 is shared on private platforms. So it's shared in Messenger, it's shared in WhatsApp, private groups that have discussions. So the majority of projects that are doing social media listening projects are only accessing that public data. And so we like to refer to that as the tip of the iceberg. So it's another argument for our small data approach is that, you know, a small amount of data could suggest a much larger sharing of that misinformation amongst these private groups and discussions. So it's really important to keep that in mind when you're looking at social media data and not to only respond to rumors that have 10,000 retweets or 5,000 retweets. Information silos and cascades. They're a problem in any kind of data collection, I would say, in any kind of listening activity, but particularly in social media. Social media information cascades basically mean that the more someone sees the information repeated online, the more likely they are to believe the information and assume that it comes from a valued source. And so with social media, information flies around so quickly and is retweeted and shared so quickly, information gains a credibility that perhaps it doesn't deserve very quickly. And information silos, what we mean by that is that we do all operate within our silos. My Twitter, for example, is full of humanitarian people and development people and media people. I don't capture the whole of Twitter in my personal profile. Similarly, in my Facebook, I have a silo of people who are likely to be friends and colleagues and people who have a similar experience to my own. So we need to really make sure that we're stepping out of that bubble to make sure that we are capturing the widest amount of information possible. And that's why the final point, the mixed data approach, is so important, because we really do need to supplement social media data with multiple types of data to make sure that we can compare and capture other elements from the community. Okay, and next slide. And this has been expressed by Eva as well, but it's a continuous process. So it's a continuous process of listening and responding and analyzing and listening and responding. It's not a process where you can identify a rumor, replace it with a fact and consider that your job done. There are always follow-up questions. There's always more information to be given to the community based on their needs. They will always have, clarifications or confusion or questions. Next slide. And just very quickly as well, and I guess I would say this is an advocacy call for people to look to media as legitimate partners, and especially in all humanitarian response, but especially in this particular crisis. Local media are really a key piece of the information puzzle in many of these contexts. Of course, there are some contexts where media is not a trusted source of information and wouldn't necessarily be the best partner. But in many of them, and especially in these times where we are restricted by the amount of field work we can do and the amount of community liaisons we can have out there, this is really important. I can see someone there saying PSA. Yes, PSA is public service announcement. So I think what often happens when humanitarian and development partners work with media, they quite often send them a press release and say, this is what we want to talk about today. Or they send them a public service announcement, a short audio clip with some behavior change communication messages, and then job done. What I'm advocating here is to really see them as a partner in humanitarian response, not just a place where you send information and then expect them to broadcast out. And I think in the past there has been an issue with trust. For example, local media might ask for an interview with a humanitarian organization, and they have to send the request to Geneva or New York, and New York thinks about it, and they send back their spokesperson who might not speak the local language. And a lot of that is based on trust, trusting local staff and trusting the media to be able to play a role in this. I think the other things to consider are that journalists are community influencers. They're during hours and after hours, when they have the microphone or when they don't. They're generally fairly well respected as members of society. So the more we can engage them and the more we can help them to understand the information about COVID-19 and be able to explain it to friends and family, as trusted information providers, that information is going to go further and be more likely to be believed. So we need to support media. We need to give them the tools that they need to be able to respond to these complex questions they're getting from the community and engage over the long term, really build their skills so that so that when they do call you with a question, it might not be for an interview, it might not be for your spokesperson, it's just a question to understand virology better, for example, that we answer the phone and we take the time to build those skills so that the next time they get that question from the community, they're in a much better position to be able to answer it with authority. Next slide. And that's me. So as I said, we're just launching a new project in 7 countries. Some of them are listed there. That is my email address. Do feel free to reach out if you wanted to talk about qualitative rumor collection, working with social media or working with local media as partners. I'm always open to chat, and especially would love to chat to partners that are in those locations and would like to know more about what we have planned. So thank you very much.
Thanks, Irene. Thanks so much. So we'll go now to the last one, who is, Meg Sattler. Here we go. So over to Meg for the last presentation. Please keep sharing your questions. They're great. We're going to discuss the top 4 challenges and the key questions at the end of the presentation. Over to you, Meg.
Thank you, Bretta. Good morning, evening, or anywhere in between to everyone. And a very big thanks to WHO, IFRC, UNICEF, and the network for inviting me to speak. It's a very timely and critical conversation to have, and I very much look forward to the Q&A. What I'm going to cover today will be our process of tracking perceptions on COVID-19, some of our findings or their themes, and also some of the lessons that we've learned along the way, and some critical questions that we've been asking ourselves. For those of you who aren't familiar, Ground Truth Solutions tracks the perceptions of crisis-affected people in humanitarian contexts, using their feedback as a performance monitoring metric aiming to increase the accountability of the foreign aid system to those that it exists to serve. If we go to the next slide, I just wanted to remind everyone that we are at quite a critical point for the humanitarian sector and indeed the world, where this pandemic has really taken life and work as we knew it and turned it upside down. With that in mind, I think there's actually never been a better time for us, particularly as international agencies, to collectively examine the community engagement efforts in our sector without falling into a tendency to, I suppose, PR our efforts. Given the challenges and the unprecedented nature of what we're dealing with, I think we should all feel a bit more comfortable in trying to unpack and act on some of the challenges and not be shy about talking about where we might be getting it wrong as a collective, especially given that we have this RCCE structure now and we are all in this together. So I think it's quite a good opportunity to discuss what we've been trying, recognising its limitations, and also to hear a bit more from the global health community on what might better inspire action off the back of our work. Excuse me. If we go to the next slide, just a quick overview of the history of what we're doing at Ground Truth. If we look back to February, many of us were at Partnerships Week in Geneva when COVID-19 was just taking hold. Signs were up on the walls promoting hygiene, but it still felt like a very distant threat. Just a couple of weeks after that, the world stopped. And at GTS, our HQ in Vienna was affected quite early. The Austrian government installing, I guess, some of the harshest measures the earliest, which meant that we had to halt all of our travel. We reassessed every project that we were doing as we watched what was taking shape globally. What we found interesting then was that suddenly perception tracking was everywhere, at least it seemed to be. But then when we peeled the top layer away from that, we soon realised that perception tracking was really only scratching the surface. It was only seeking the views from what we could see of those in wealthy countries with both the means and the free time to participate in online polls. There was also, and I hope those on this call forgive me for saying this, there was a lot of smoke and mirrors around humanitarian perception tracking. I think a lot of coordination calls where people said they were doing it or wanted to do it, but it didn't actually eventuate. And because we had learned in Ebola that without understanding people's perceptions, public health and social measures very easily fail, we set about tracking perceptions wherever we could. We mapped what was being planned already, what we thought was missing. We looked at the emerging global response plans, and we designed an approach that would track people's access to information, their trust in measures introduced to contain the virus and those people enforcing them, factors influencing behaviour, and also how people saw the unfolding economic impact. If we go to the next slide, why did we want to do this? We wanted to make sure that the ongoing global response was informed by and adapted to the perspectives of affected and at-risk communities in humanitarian settings. And we also wanted to make sure that global analysis would inform research and learning both for future health crises, but also for the ongoing response to COVID-19, given that it's going to go on for some years. Linked to that, we especially wanted to make sure that ongoing lessons learned don't favour the global north. So we wanted to make sure that we were capturing the voices of those in crisis-affected countries. Next slide. I won't go through all of these countries, but as you can see from this slide, this is a growing approach. There's increasing interest in it, which is great. We're tracking perceptions, or are about to start tracking perceptions, across the Middle East, Asia, Africa, and we're also about to launch a project with UNICEF in Haiti. This work supported by H2H, the World Health Organization, UNICEF, the German Foreign Office, the British Red Cross, and was kicked off with support from DFID and SDC. Next slide. I won't go through all of our findings just due to time. I would encourage you to look at our reports, and I'll share a link for that at the end of my talk. But one finding that's interesting is that in almost all countries, people respond quite positively on whether or not they have the information they need to protect themselves from the virus. That's good. What I wanted to nuance this finding with, though, is a reminder that information provision shouldn't exist in a vacuum, and that touches on some of the things that Irene said. If we ask people whether or not they feel they have the information they need to protect themselves from the virus specifically, they do tend to say yes. However, looking a bit deeper into that, they are plagued by rumours. I think most of you would be familiar if you saw our report from Uganda on the fact that people were referencing marijuana as a way to combat the virus. A lot of people across Africa think it's a white person's virus and won't affect them. In Iraq, there's a lot of different information going around about home remedies and whether or not it's a direct threat. There's also a lack of general information. So while people may feel they have information for self-protection, in Iraq, for example, people were asking for far more information about local cases, different health information, etc. There is a big fear of missing out on aid, particularly in Syria and Iraq, that is tied to information that people are receiving rightly or wrongly about the virus. And everywhere that we're doing surveys, we're finding that there's actually an inability for people to practice what they know. So people might know what they need to do to protect themselves, but they don't necessarily have the means to be able to do that. And I'll touch on that more in a minute. If we go to the next slide, this is just visualizing what I just said. So these are the answers to questions on whether people feel that they have the information they need to protect themselves from the virus. As you can see, it's not perfect, but it is overwhelmingly quite positive, but something that we need to address with nuance. On the next slide, we thought it would be important to track people's main information sources versus their most trusted information sources. And what we found overwhelmingly was that these didn't necessarily match up. I've put Iraq here as an example of a country where it does, and it was actually the only country where there was strong overlap between the two. So you can see from the graph, people trust news media, which is also where they're getting a lot of their information. And there's sort of a sliding scale then from social media down to national government. Of course, if people do not trust their main sources of information, there is likely to be a direct impact on their health-seeking behaviour. Likewise, if they do not have sufficient information from the sources they trust, it will have a similar impact. And if I go to the next slide, you can see how that's played out for Syria. So people we spoke to in Syria overwhelmingly said that their most trusted source of information on coronavirus was health providers. They're not getting information from health providers, though. They're getting it from news media, which they trust probably the least. This doesn't necessarily mean as a recommendation that we want health providers to go around sharing information. But if there are media campaigns, humanitarian campaigns, etc., that don't make it obvious that media is coming from health providers, it means that the trust is likely to be lower, and that may impact community behaviour. That was very different in every country. So in Uganda, overwhelmingly the main trusted source was community leaders, whereas in Iraq there was a lot of trust in mainstream media. So I would again encourage you to have a look at our reports. If we go to the next slide, just another reminder that information access does not equate to citizen behaviour. I've put a quote here from Syria that I think illustrates this quite nicely. And this was from a community leader that said, because there are no reported cases in the area, people don't care about the mitigation measures. And even so, even if they did, they can't afford masks and gloves. So just a reminder that while there seems to be a lot of validation in the fact that a lot of international agencies particularly are spreading a lot of information, that doesn't necessarily equate to anyone's ability to act on that information. If we go to the next slide, and I do apologise for the busyness of this slide, it's not normally one that I would share. However, I thought it was interesting because what we've done here is compared the measures that people have considered to be the most important versus the ones that they consider to be the most difficult, and often they're the same. So many of the measures that people understand, trust, and consider to be important are those that they also feel are the most difficult. That relates to staying at home, for example, which has linkages to income-seeking behaviour, social distancing, which makes sense when people are living in camps, etc., and also even the inability to wear a face mask. So one of the main challenges highlighted by Ombretta was community engagement activities existing in a vacuum, and this is one we talk about often. So what does it do to people's feelings of resiliency when humanitarian actors might be bombarding them with information, telling them to do something that they then can't do? So more than ever, I think there's a need for feedback to be directly linked into those responsible for facilitating the response. If we go to the next slide, having a quick water break. We have found that trust is very high. So we asked this question, does your community or do you believe that the measures introduced in your area will reduce the spread of the virus? That is overwhelmingly high, perhaps with the exception of Syria, where it was 63% yes. There was quite a degree of regional variance there, which I will just say as a caveat. We have found, though, in other contexts that questions of trust can actually be better linked into feelings of hope if you unpack them a bit more. So this is something very positive, but it will also be very interesting to see how this pans out as we continue tracking perceptions over time. Hopefully it will remain the same, but if people, I suppose, continue to answer negatively on some other metrics, we will probably begin to see this go down. Next slide, we have found that people's concerns overall are definitely more economic generally than health related. There's a quote here that illustrates this quite nicely, where someone in Uganda has told us, most people are worried that they will die of hunger instead of coronavirus because most people no longer work. The ability to meet basic needs has worsened across all countries where we've done this research. In Iraq, 74% of people said this. In Syria, it was 81%. In Uganda, 90%. And this relates both to overall economic decline, as well as restrictions on aid and movement in crisis-affected countries. Contributing factors were noted as price increases, lack of jobs, inability to access shops, curfews, lockdowns, etc. The reason that I flag this as an important finding, although it's probably quite obvious, is that I think when we think about economic impact with regard to this health crisis, we are putting a lot of effort into community health messaging, where perhaps I think there's an opportunity to work more with national systems on economic messaging. The same would be true of Australia, where I am now, where people's biggest concerns may not be tied to directly catching the virus, but more how to access social protection systems. In our research, we've paused here a little bit to start to unpack at a more qualitative level factors that influence economic impact, people's own coping strategies, and also how COVID-19 has disrupted, or hopefully not, the efficacy of overall response efforts. And this is to help us on this economic question start to answer this so what question that may come up from some of our findings, to make sure that they're a bit more actionable for humanitarian actors. If we go to the next slide, please. Where to from here? So we're pausing at the moment to adapt our approach per country, given what the findings have told us so far and what we see as being the biggest gaps. But our main objective as Ground Truth is always to ensure that we, as custodians of such data, that people are listening to it and that the right people are listening to it. And if not, I dare say it risks being worthless. We have found some interesting means to dialogue these findings through forums like this one, through in-country and regional RCCE groups, clusters, bilateral consultations. We're also working with community leaders in Uganda to dialogue the data that we have, ensuring that refugees are equipped to use the findings for their own advocacy. And we'll of course seek ways to do this in other countries where we work. The lack of face-to-face interaction has made this very difficult for us, if I'm honest, not just because we can't travel, but because there is a degree of fatigue in online means of communication. And so much of what we do as Ground Truth is based on the premise of face-to-face dialogue. And then I just wanted to quickly go through some of the challenges that we have faced in this process that may also resonate with some of you, and hopefully inspire some brainstorming on addressing them. Ensuring data quality has been really hard, both in terms of the data itself, but also in terms of the quality of the interaction with people. Our methodology is very much about conversation, and so we have mostly moved to phone-based consultations. People don't want to talk for as long. They still prefer face-to-face, whether or not it's safe. And the quality of that interaction then tends to go down. Sampling has been incredibly difficult. And our stats team, our brilliant stats team, have been working very, very hard per context to build a sampling frame that they are happy with, ensuring that we have a degree of robustness by way of geographical coverage, particularly with the participation of vulnerable groups. To combat this, we've been trying different things, like, for example, doing more surveys in total and discarding some of them to then ensure that the percentage of women's voices is higher. We're also supplementing phone-based surveys with specific key informant interviews targeting different vulnerabilities. We find it hard to make sure that we're getting informed consent, so we really have to reiterate that. We have people dropping off the call, we're finding it difficult to understand disability, etc. So phone-based surveys are a really great methodology in some ways, but they're also quite fraught. One thing that this makes us concerned about, given the proliferation of agencies who do want to start doing perception tracking or indeed have started doing it, is the dangers of dodgy data, as Nick van Praag put it. It makes us slightly concerned because what we've learned from years of doing perception tracking is that if people simply don't want to listen to your findings, the first thing they'll do is tear apart your methodology. So we've been trying to do this better. It is very difficult. Another challenge that we have found is that the countries we've engaged in have been very much based on the fact that we've either been there already or funding has been available for those countries. I think there is a good opportunity for us as a network globally with the support of some of these bigger agencies to make more strategic decisions about where we want to do this and why. And I guess also some of the difficulties of providing a seamless coordination service, particularly given the challenges in being in country and working face-to-face. We fear that this may exist more on paper sometimes than it does in real life. And so to this extent, we're really looking forward to the RCCE strategy process and how we might contribute to that. If we go to the next slide, as you can tell, I'm losing my voice, so I'm going to leave it there. But I've put on this slide a link to our work on COVID and also our reports and my email address. So feel free to get in touch with me if you have any questions or want more information. Thanks very much.
Thanks, Meg, and thanks to all three panelists for a really insightful presentation and for sharing your learnings with all the people. What we do now, we have around half an hour, so we'll spend around 20 minutes discussing a bit some of the challenges you find are the top challenges for turning the feedback into action for the COVID response, and then go to some of your really interesting questions and have a chat with the panelists. I'm going to have like maybe one of you to come up with your recommendation and your experience for some of the challenges we've discussed at the very beginning. So I'll go again to the challenges we put up at the very beginning. And it does link up with what Meg was saying around this dodgy data, this feedback data, and the fact that some of the times this data are might be critical data and might be criticized by some people and the methodology taken apart. Sometimes some of the experts feel that these qualitative insights are less credible compared to the quantitative methodologies that are used. So I want to hear a little bit from Eva and Meg around some of your recommendations, but also some of the key challenges that are linked to the unpacking this key challenge. So these qualitative insights being less credible. So Eva and Meg, do you want to comment on that? Over to you.
Sure, thanks, Umberto. So Meg, maybe I'll go first and you can complement if that's okay. So yeah, I think we all know that challenge. Very often it happens that rather than discussing what to do about the data, the results are explained. So like people are saying, oh, it's not representative, or how did you even collect it? But I feel it's changing a bit. I feel we see a change. At least that's what I'm seeing as part of the COVID-19 response. So people are actually asking for community feedback insights. We can definitely see that as now during the EVD operation, the Ebola operation in Ecuador. And I think what helps is definitely to link it to social science research findings, to be very transparent on how the data was collected and on how many data points you have. So for example, in DRC, we had thousands and thousands and thousands of data points. If you show exactly where you collect the data, and we still have these thousands of data points, so showing where you collected the data, how you collected it, and how you're analyzing it, already does a big part of it. And also repeating findings helps a lot. So you cannot only put one feedback report, but if you are able to show over time, this keeps coming up, this keeps coming up as one of the main topics, of the biggest concerns, it is difficult to keep ignoring it. And another point I wanted to mention as well is to try combine different channels. And for example, maybe you have reactive ways of collecting community feedback data. So what I mentioned, like if our volunteers are collecting community feedback data during their regular activities, but then maybe you have perception surveys where you have a specific sampling approach, and this is what Ground Truth Solutions, for example, is doing in a great way. So this then really, like, there cannot be anything done about that anymore. But yeah, to wrap up my comment, I want to say that I feel we have to stop worrying about that and really focus on the concrete actions. And I see a shift in yeah, being transparent about how it was collected and how many people this is actually representing should already help. Thanks, over to you.
Thanks so much, Eva. Meg, over to you for commenting on this.
Thank you. I just add to what Eva said that I think, I mean, something that we find as an agency that generally tends to focus on the more quantitative side is that I think people like that to the degree that it's interesting, and they like seeing our fancy graphs and they like how neat it is, but the so what factor is very high if you're relying just on quantitative work. So I would recommend that in any sort of data collection exercise that if possible, a mixed methods approach is favoured, because that way you can find out at a base level what is interesting or relevant through a quant survey. And on some metrics, that's easier than others. So for example, do you have enough information, yes or no? You can get a lot from that you then can act upon. But if you don't then ask why and how does that differ from men to women and who needs information from who and when and how, then it sort of doesn't mean as much. So I would say that the qualitative information that we have started collecting more often has sometimes helped humanitarian and health actors to be more likely to act on our findings because they become more human and I guess more relatable with that qualitative factor. So I would just say a blend of both is quite useful.
Thanks, both. And in fact, we've seen this over and over also in Congo, in the DRC response, that this qualitative data helps us unpacking some of the quantitative findings and finding out the so what, responding to the so what questions. So definitely blending this data together, triangulating mixed methods approaches, really, it helps really understanding what's behind some of the quantitative data. I'll go quickly also to another challenge, which is one that might need more discussion, but is of course is one that we're finding over and over, that community feedback, community engagement work is often siloed and relegated to the to a problem for community engagement experts, so risk communication experts. And I'm sure you've experienced the same. We've lost Irene because she had another commitment, unfortunately. But I wonder if maybe Meg, if you want to comment on that before we go into some of the questions.
Sure. Thanks, Umbretta. I think it's one of our biggest challenges at Ground Truth is that we often as an agency get relegated to this accountability or community engagement basket. And it means that people find our work very interesting, but often we feel that we're talking to other agencies who are also in that basket. Nick, our founder, actually wrote a really interesting blog about this that you can find on our website. But I think particularly for coordinated efforts, we see this as being increasingly a problem where a lot of us have pushed very hard for collective efforts on community engagement for a very long time, and they're finally starting to take hold. People are putting more resources into collective community engagement, but it almost then starts to become, or at least it risks becoming, and maybe we can think of creative ways to get around this, a separate structure in the response where community engagement actors talk to other community engagement experts about the issues, they find out what they are, and then they collectively come up with ways to address them. And there's an expectation from response leadership that that's how it works. So I guess a way to address this structurally is to ensure that as such groups as RCCE or AAP working groups continue to proliferate, that they are tied in more to intersector or more of the kind of operational elements of a response. And also just on the dialogue side, I think one success that we have had at Ground Truth is embedding our perception surveys as metrics in humanitarian response plans, which you've probably heard us talk about a lot. But you can do that in a lot of different facets of work. So for example, for COVID, what we could do is to say, this is the global, national, regional, whatever response plan. These are the metrics that we are trying to achieve through this response plan. How do communities understand how this is going, and then use a perception survey as a way to track that rather than something that just exists in isolation. And also in terms of dialogue, when we're having discussions in country, we actually very rarely spend a lot of time talking to a lot of other community engagement specialist or expert agencies and put much more of our efforts into clusters, response leads. We always try also to change our questions or our methodology to be more tied into their own response plans and their own sort of ways of understanding a response. It definitely needs a lot more work, but those are some of the things that we have tried. I think for COVID, we found it a bit more difficult because we are much more used to working with traditional humanitarian actors, and this overlap between health and humanitarian actors has been difficult for us, I suppose, to crack. But that might be another thing that we can think about addressing collectively as an RCCE community.
Thanks, Meg, and thanks for highlighting also one other challenge that definitely there is a bit of a silo approach between the humanitarian partners, the humanitarian space and the health space, where we have different actors often acting and working in different ways with different structures. So this is also a challenge for a cross-cutting issue like community engagement and risk communication. I'll go quickly to some of the questions. We won't be able to respond them all. I'll seek more advice from the WHO team if there is a way also that we can respond after the event. So I want to go to one of the questions that is about the local organization and their capacity or the support that we can give to local organizations to analyze qualitative data. In fact, so here is around, can you make recommendations on software for qualitative analysis that is friendly for local organizations? This is a very relevant question, and it is around what Meg was saying around making sure that we understand, and Irene as well, that we have a hyper-local understanding of what questions, feedback, and rumors are happening at the more localized level. This is where we can make a difference. And I want to go to Eva for this question, and she can also maybe talk a bit about the kind of tools we use for this qualitative analysis, which is a very basic methodology that can be used by local organizations. Our volunteers on the ground and staff on the ground are doing it by themselves in DRC, for example. So over to you, Eva.
Yeah, thanks very much for this question. Yeah, it is a really relevant question. And what we want, what we are doing in the movement, in the Red Cross, Red Crescent movement, is finding ways that can easily be replicated in any country. So what we are doing is we are using Excel, because this is, I'm sorry, this is what everybody usually, most of our colleagues have access to Excel, and we are not using, we have explored using algorithms, teaching algorithms to code our data automatically, or thinking about using other softwares such as NVivo for qualitative data analysis. But what we really want to achieve is that our colleagues sitting in the middle of nowhere, only having access to a laptop, know how to add the data into an Excel file and categorize this information. And this does not always have to be thousands of data points. This does not work if you do social media scraping, of course, but if you're documenting community feedback during your activities, then our colleagues are able to review the data, add the data, clean the data, and then categorize them. An issue with teaching an algorithm, for example, is the language issue, and then often the data is not clean, and there is, like, you need the local understanding of the data. Of course, it's possible if you have huge amounts of data, if you want to do meta-analysis, but what we are recommending is to come up with very basic way of analyzing the data and engaging with the data. And what we are using is Excel, and we are happy to share our resources for that. Over to you, Ambretta.
Thanks so much. Thanks, Eva. So also to say, there was another questions for Eva around sharing the feedback questions. As Eva said, this is not a questionnaire, it's not a survey, so we don't have specific questions, but is about capturing unstructured data and conversations that are happening, which is the beauty of this, but also the challenge of this feedback data. Irene has left as well. Same for Internews and the partners there. WHO does this capturing of rumors online as well. Mindy can talk more about that. So is not about extracting data from people through surveys or asking the questions, but really getting into their conversations and their dialogue and capturing some of these key findings. So I want to go a bit into the trust question, the elephant in the room, trust. We've seen from Internews data, from previous data, from feedback data, trust is in great demand, short supply at the moment, especially in Africa. We've seen this type of data. So trust in government. I know that the Interagency group, the partners in Africa, have been discussing this and addressing this. I want to hear from Megan and Eva, and also from Mindy. Please come in from the WHO perspective, also around how we are addressing this trust challenge. We've seen it also during the Ebola time. What's your recommendation there? Especially because we've seen that some of the trusted sources of information are health workers. So over to you three.
I can start. I think one of the main things that we've found at Ground Truth on Trust, which has been really interesting and actually something that we wrote a paper on last year, was that to address trust, we actually have to get better at understanding it. And the reason we came to that conclusion was that we tend to ask, or we have historically asked, direct questions about trust. So do you trust that aid workers have your best interest at heart? In COVID, we're asking if people trust that the measures in place will help quell the spread of the virus. But we find that overwhelmingly, the answers to those questions are very positive. Sorry, excuse me, I'm losing my voice. But if you then look at all the other metrics, which may, as a composite, give you more information about people's trust, they tend to be quite negative. So whether people feel that things are actually working, whether they feel their lives are improving, whether they feel that they're able to act upon information they're receiving, examples. We have been talking to IFRC about trying to come up with some sort of trust index where we might be able to, as a composite indicator, understand more of these factors and then use them to better inspire action. Because at the moment, I think we don't necessarily know enough per context about different factors that influence trust. But another quite basic thing that we find is just if people feel listened to, that trust metric does tend to be a bit higher. So if people feel that their opinion has been taken into account in a response, they're probably more likely to feel that that response is going to work. And that's something that we have found from a number of years of Ground Truth inquiry, which is quite basic. I think for the pandemic, it's quite complicated because of the plethora of different actors involved in that. So we might ask about trust and people might respond, but we don't necessarily know if they're talking about UNICEF, if they're talking about their own social protection system, if they're talking about their health system, etc. And I think what that comes back to also is the need for us all to communicate and coordinate a bit better at the local level across that constellation of actors, and then be able to demonstrate that people are being listened to and that things are being done on the basis of that feedback. But I don't know, Ava, whether you've got a different perspective on that.
No, absolutely. I completely agree with what you just said. And yeah, for me as well, key to building trust is really to use the community feedback and show how you've used it. To show this is what we've heard, what can we do about it, and to combine the community feedback mechanism with also systems to discuss that feedback and to plan together with communities on how this how certain things can be addressed, to work with local groups to find solutions for these problems. So to find ways to engage youth groups, community leaders, religious leaders to really tackle these issues. So to be aware of communities, what communities are saying, then plan the response to these issues together with key groups and key influences of the community. So the trusted entities in the communities, and then to close the feedback loop and show, okay, this is what we've done, these are the discussions we are having, these are the decisions we've taken, and this might not be possible. So not only, sometimes we are so afraid of the feedback because we feel it's too difficult to respond to it, but communities understand if we can explain why certain things are not possible. It's just about providing the information that they often don't have. And if we don't have the information, we create our own realities and we explain certain processes, usually not in a very positive way because we don't have the information. So it's providing the right information and providing an explanation for certain measures or certain decisions usually can already increase the trust in the response in general.
Great, Eva, thanks. So I go to Mindy. So saying the why and the how and discussing this is definitely really key. I'll go to Mindy for a comment on the distrust question and then for the closing and recommendations coming up of the webinar. Over to you.
Okay, yeah, I'll just touch on, I mean, I completely agree with what Eva and Meg said in terms of how to increase trust, particularly on the community level. I mean, you know, right now I'm at the WHO global level, so how we're viewing trust and really trying to increase trust in our messaging and so on, and it's sort of a different dynamic. One of the things that we're really working on, which can completely be used at the community level, is to identify trusted influencers. So we're working hard to ensure that we're establishing what we're calling amplification networks. So outside of our traditional social and mass media, really trying to work hard with leaders in different sort of these networks. So as an example, youth leaders or employer networks, faith-based organizations and so on, and sharing our information, but also doing it in a very adaptable format so they can take information and put it in their own voice, which will increase trust. So relying on these different networks, and as was mentioned too, relying on healthcare worker networks as well, like unilaterally almost viewed as one of the most trusted sources of information. So outfitting them not just with the right information, but the ability to share that information so that their patient population can really understand and adapt it and maneuver around barriers that may exist within their communities. So that's my answer to that. I just want to thank everybody for taking the time. This was a slightly longer webinar than we usually have, but largely the participants have stayed really engaged. There were a number of key recommendations, Bretta. So I just picked up a couple of things from Ground Truth to better embed metrics in the response plan and to ensure that our communities are included in the response efforts. And putting, really focusing the work on community feedback with response leaders as well. From IFRC, I heard need to really include local understanding of data and using very basic methodologies to help the feedback mechanisms as well. And then just some other ideas that I picked up along the way, just to reformulate recommendations versus in terms of an ask, not just a tell, so that when we're working with communities, we're asking, you know, if they agree with some of the recommendations and can use them if they have other ideas, linking more strongly to social science as well. Yeah, and then I think, you know, just providing more and more qualitative data and the stories behind it that may resonate. Yeah, those were some of the key things I had picked up. Umbretta, did you pick up anything else?
I think there was also there were also some recommendations around engaging the local actors, the local organizations. This is coming from some of the experiences in Liberia, making sure that they have the skills and the capacity also to really pay attention and collect and analyze this type of data that helps them in understanding the sociocultural reality on the ground, the key perceptions. So this was one of them. I'm also looking at, thanks for Catherine from the RADI initiative and Monica for clustering some of the recommendations there. Just skimming through them. I think, yeah, sharing, I think the recommendation is for really making all these tools available to the audience. I think WHO, let me know, Mindy, if in the follow-up email, these can be shared, so more will be coming in the email.
Yeah, we'll pull together the questions that didn't get answered, and we can pull that together in a frequently asked questions list and post that, as well as some of the other key recommendations that came out of this. So thank you everybody for your time, and to the panelists, thank you very much for your presentations, and Umbretta for facilitating this really interesting session. Any other closing words, Umbretta, that you would like to?
No, thanks very much for WHO for giving us the opportunity, Mindy, for creating this community of practice. I'm sorry we didn't have the floor, we didn't give the floor to one of you for more insights. There are many people participating here and it is great. And we hope to be interacting with you on emails, or please get in touch with us for continuing this conversation. Thanks.
Yeah. I will add that we're hoping that this is just one of many in a series of webinars that we can continue to really build out what's needed, not just in COVID response, but for risk communication community engagement as a whole. So thank you very much for joining, and we'll see you next time.